Hi, welcome back to my channel. So today I just wanted to talk about my experience of being a VA, being a veteran that uses VA, right? So I just retired. I don't want to keep saying but I did retire in December, right? And I've had VA healthcare since December. So the last video I had was February and now it is July. So I'm going to give you just some updates from February to now. Okay. So I wrote it down. So this is what happened. Okay. In February, I finally got assigned a PCM, but in the VA, they call it PCP, which is primary care provider. I still call it PCM because, come on, Air Force, like it was PCM in the Air Force. Okay. I got like assigned a PCM or PCP in February, and it's literally 15 minutes from my house. So that was a blessing. My provider, he could be my age. Like, he's very, very relatable, super easy for that very first appointment. And then he was like, let's schedule an appointment in a year. So I have an appointment scheduled for next February. Okay. So ever since then, anytime I needed to talk to him, I could send a message through the VA app. So it's very useful to have the VA app because that's where I check for any updated messages or something for my medical or prescriptions, right? So anytime I need to get a renewal prescription, I just go to the VA app and I click on renew, and then I believe it goes to my medical team, my provider team. They approve it, and then probably within 2 weeks I get sent the prescription in the mail. It just comes in a package, literally. So that is a blessing for that. But anytime when I need to talk to my actual doctor, my PCP, I will message him. So it goes to his care team, right? And I usually get a response back from his nurse. They are very timely. I can get a response back. We can go back and forth, or either it's like the next day or the end of the day, right? So I really appreciate that. It's a CBOC, which is just like a local clinic instead of going to the big VA hospital. And if you're not close to one, like I'm like an hour away from a VA hospital, then they will get you into a CBOC, which is your local VA clinic, right? Like a smaller clinic. I'm sure they have a lot of patients, but my care team she on it, okay? The nurse is on it. Anyway, so anytime I need to say, hey, I would like to schedule an appointment or something's wrong with me, do you have any advice on what I should do to help with my ailment? I get a response back and they tell me what I need to do, or they'll tell me, I'll pass this over to your doctor, and then your doctor will let us know where we're going to proceed from there. So my doctor will call or either message me and let me know that he has set up a referral, or that I should just go to the ER or something like that. So my care team is very, very responsive. I really, really appreciate that. Now, when I have to go, to the big VA clinic, which is about an hour away, it's the absolute ghetto. Okay, like, snot just came out of my nose. Ghetto. And I mean a huge clinic, like a hospital, like probably the biggest hospital I have ever been in my life, right? Veterans everywhere. And I mean, some of them look like they could have been homeless off the street. There's a lot of people, I don't want to say a lot of people walk around in wheelchairs, but there's people being rolled in wheelchairs or rolling themselves. Like, there are some real disabled veterans. So not to say that I'm not a disabled veteran. We all have different disabilities, and plus, our ages are probably like 40 years apart. So, people age, not everyone gets to age gracefully, right? So it's a humbling experience for you to go there, for me to go there and be like, ooh, I don't take nothing for granted in my life. Absolutely nothing. So anytime I had to go to the actual VA hospital, it's a trip because there's so many floors and it's so expansive that I literally have to, like, someone has to guide me to where I'm going. So I'll get off the elevator or get off the breezeway, and I go to like the little board that has like every clinic inside the hospital. Somebody, I don't know, I think this is actual job. People be like, hey ma'am, can I help you? What are you looking for? And it's been a person that works in a clinic, a person that looks like they are just there to greet people and help people around, and then a janitor. Okay. I don't know if I gotta look at my face like I get lost, but I'm telling you, the people there are very friendly. They will stop and help you out. Even if you're looking at the board and you look like, I know, it's third floor, I can take you there. Let me take you there. Very, very nice. I will tell you that. So that part is a blessing. But when I say ghetto, is my experiences at my appointments at the hospital. I feel I have been talked down to by a physician, okay, who you can tell has never been a veteran a day in his life. And the VA hospital that I am assigned to is next to a big university hospital too. And this was a university doctor that maybe he has two jobs. Maybe he works for the VA and a university hospital, but he was an a-hole. And I'm telling you, for months, I was thinking I should report this guy because super talked down to. And the thing is, he was about 5 foot nothing. Like, I could step on him. Like, I'm trying to be Christian, okay? Like, I'm trying not to spaz out. But I would come for you and your mama and that red hair on your head. But so I didn't. But I for a long time, I was like, I really should go to patient advocacy. Anyway, so that, and then let me just tell you about my experience with dental. Now, whenever you get your DDT 14, it'll have like a little block that says you did not go to dental within the last 6 months or a year of you getting out of the military. So everybody should have that block not checked, right? Because you want to be able to get VA dental. Now, I will tell you this. I've been retired 8 months, basically 7-8 months now. I have not been able to see dental since I've been in the airport. So let me tell you about my dental experience at the VA hospital. So this is February. I called and said, hey, I would like to get a dental appointment. The lady said, you actually have to register for VA dental coverage. I said, I'm already a VA medical recipient. She said, you have to register too. Everybody that is a medical, like Medicare, whatever recipient for the VA, they still got to register for VA dental. Didn't know that, but did it, okay? And she was like, once you get that done, give us a call back. I called back and I let her know what happened. And she was like, okay, good. I have to wait to get you a provider to get seen. I called back a month later and I got a whole different lady. I said, hey, I would like to be seen by the dentist, dental, whatever. She's like, well, let me double check to make sure that you have registered. She said, I saw it when you registered. She said, I'm going to tell you the truth. It's going to take a while. Like, providers we don't have enough providers. Okay. So within that time frame of March to July, I had to go to the hospital a couple times, and I've been to the dental clinic twice for an actual question, right? Just to ask, like, what should I be doing? I had this cosmetic thing that I want to update, and found out they don't do any cosmetic procedures or like if you used to wear Invisalign or you need trays, don't expect the VA to help you. Okay. So anyway, so my last time going to the VA dental without even seeing a provider, but I stopped by. I got someone who actually was educated in his position of what he needed to do, and he knew the facts. He was like, I had asked him, I said, hey, so I've been retired since December. I would like to see dental, like a provider. The look on his face said it all. He said, in reality, you will not see a dental provider from this VA clinic hospital until December of 2024, when I registered in February of 2024. He said, that's how behind we are, understaffed, overworked we are. I said, okay. And he said, well, I'm gonna do you a favor. I'm gonna put in a referral for you to get a local dental provider near you. He was like, how far do you live from the VA hospital? I said, an hour. He said, with traffic, without traffic? I said, it's an hour, right? So he put in that little request to say that I'm looking for a local provider. And he said, I'm gonna let you know this right now. This is a piece of paper where you need to call to check up on it. But number one, you probably need to wait a month before you call them, because that's probably how long it's gonna take for them to get to you. And number two, they're probably not even gonna find a provider in your local community, because the VA has not paid the VA has not paid their claims to local off-base providers, basically. So I'm sitting there like, what am I? This is an alternate universe. Like, we are drilled in our brains when we go to TAPS and we get a VA brief. Make sure you go to the dentist or VA dental within 6 months. You get free VA dental health care. Since when? I did my due diligence. I signed up after I retired. I've been patiently waiting. I call for a checkup, and you realistically can't see me for a year. So he said, we have walk-in hours though, 7 to 8, and I want to say it's either 12 to 1 or 1 to 2. I live an hour away. I'm not showing up at 7 a.m. for nobody, okay? And number 2, right now I'm busy. I can't come through at lunchtime. Like, what kind of answer is that for veterans? So that's my dental experience, non-dental experience. So on top of that, I did end up getting Tricare for myself, right? So I signed up in the month of March for Tricare. So that's about I was so close to my 3-month period, because you only get 90 days. And after that, you would have to register when it's time for like new people to register, which would have been like a year at the end of this year. So 90 days after you ETS or retire, you can wait to register with the Tricare. Most people do it the day, like the very next day that they get their retiree card from the Air Force or military, or yeah, that's it. I guess you could do it if you wanted to, if you were to ETS and not have an ID card no more. But either way, I waited because I wanted to see how the VA healthcare was, and I decided after having 2 issues with the clinic, and not my local clinic, but the actual VA hospital, I said, y'all, this is for birds. I would feel more safe and better off paying for Tricare healthcare than to rely on the VA, because the VA moves so slow. So I went ahead and got Tricare in the month of March. It's $30 a month because I'm a single veteran, no dependents. So it's super, super easy, right? And then, but what I will tell you is I had to do a back payment from the day that I got out the Air Force, retired, to the day that I started my actual plan, because, you know, the government doesn't want you to be uninsured. Now, I should have said to her, well, I have VA healthcare, so I shouldn't have to pay, but I paid it anyways, because I don't want no smoke with the presidents, vice presidents of America. I pay my bills, okay? Don't come for my tax, a little tax check you give me at the end of the year, at the beginning of the year, whatever. I paid mine. So that's that. So let me just tell you about my optometry situation with the VA, okay? So it's July. So the month of, so last month of June, because my prescription from the Air Force, my last prescription, it expires in August. So I said, let me give them like a couple months in advance, so I know how slow the VA moves, to get me an appointment. Called the optometry clinic. I can't make this up. She said, look, we're not seeing patients until January of 2025. Huh? It's June. It's June. She said, so what we can do is put out fillers for a local optometrist near you based on your address, and they'll get back to you. But this is what attitude do, but don't expect them to get back to you for 6 to 8 weeks, because that's how long it takes for them to process it. Just all the attitude all over the phone. Like, all I get is attitude. Like, whew. Use that VA app instead of having to call the VA when it comes to talk to your provider. Because 1, you don't have to have like wait on the phone for someone to pick up. 2, you don't have to hear her attitude. Like, I want to call patient advocacy on everybody that answer the phone at the VA. So there's that. So she said 6 to 8 weeks, and it's probably about the 8-week period. I heard nobody. So what I did today is I called Tricare, right? Humana Health, whatever, Humana East, whatever. And I said, am I covered with for an optometry appointment? And she was like, yeah, you can see an optometrist every 2 years with the Tricare, which I'm like, okay, I'll take it. Like, what? Every 2 years? You have to get a prescription every year. But you know, I'm going with the flow with life these days. Every year you have to get a new prescription when it comes to contact lenses. I wear contacts and glasses. So there's that. So I said, okay, I'll take it. She said, all you got to do is call a provider near you that takes Tricare, and you're in there like swimwear. So I called a provider, I looked on the internet, found one close to me, and first thing I did was like, hey, my name is, so-and-so. I'm looking, to make an appointment. Do you take Tricare? And she's like, we sure do. And I was scheduled an appointment basically in 3 weeks from now. I said, I'm not waiting on the VA. I said, I'm covered. I pay for Tricare. I should get optometry. Because if it was up to them, I would go glassesless, contactless, and they couldn't care till January. That's the VA for you. And the thing is, you have always heard that VA sucked. I'm telling you the truth. They didn't get no better, but apparently that this is good. Okay, I'm trying to look at my notes. I think that's it. Okay. So this is my experience with the VA healthcare, and so far my experience with Tricare provider. Also, I haven't been to the Tricare, optometry yet, but it's literally down the street. Also, so when I did sign up for Tricare, they did give me a Tricare provider. She's literally 15 minutes down the street too. I haven't had a chance to see her because I haven't had anything detrimental happen to me, right? And I said, I want to go through the VA, at least for this first year, to see how the treatment is, to see how things go. And I'm not impressed. But here you go. Veterans first. Anyway, so let me know if you have any questions, and I'll continue to, update you with more videos on VA if you want to. So have a good day.